Today we're going to talk about the cortisol, its physiological function, and its function of in stress. So what is cortisol? It is a steroid hormone. It is produced when there isn't enough cortisol in the blood to maintain homeostasis in the blood or to deal with stress. It is produced by the adrenal gland. When the body needs cortisol, a message is sent to the hypothalamus via the sympathetic nervous system to produce the hormone CRF. The CRF activates the pituitary gland, which then produces the hormone ACTH. This in turn alerts the adrenal gland, which stimulates the adrenal cortex to produce cortisol. So the physiological function of cortisol. Basal cortisol levels help maintain normal blood pressure. Cortisol exerts influence on the reactivity to epinephrine and norepinephrine of muscle cells that surrounds blood vessels. Basal levels of cortisols are also essential in maintaining cellular concentration of certain enzymes involved in metabolic homeostasis. Cortisol also serves as an anti-inflammatory agent and also has an anti-immune function. In the anti-inflammatory, cortisol inhibits the production of both leukotrienes and prostaglandins. Leukotrienes and prostaglandins are both involved in inflammation. Cortisol also stabilizes lysosomal membrane in damaged cells, preventing the release of their proteolytic contents. Cortisol reduces capillary permeability in injured areas, thus reducing fluid leakage to the interstitium. Anti-immune cortisol suppresses the growth and function of key immune cells. The importance of this is that if cortisol was absent, the body would overreact to minor infection and autoimmune disease can result. It in essence act as a brake on the immune system. Cortisol is also important during fetal and neonatal life. It serves to follow for proper differentiation of numerous tissues and glands, including various parts of the brain, the adrenal medulla, the intestines, and most notably the lungs. Cortisol produces surfactant which reduces tension in the lungs. The function of cortisol in stress. Effects on organic metabolism. Stimulation of protein catabolism in bones, lymph, muscle, and elsewhere. The stimulation of liver uptake of amino acids and their conversion to glucose, which is gluconeogenesis. Maintenance of plasma glucose level also affects in the organic metabolism and stimulation of triglyceride catabolism in adipose tissues, which with release of glycerol and fatty acids in the blood. Inhibition of inflammation and specific immune responses also affects. And number 3 is the inhibition of a non-essential function so that all resources can be put towards dealing with the surfactant situation. It also enhances vascular reactivity, which increases the ability to maintain vasoconstriction in response to norepinephrine and other stimuli so that the body can engage in fight or flight response. And that's the end of our cortisols.